Recently, Mr. Patrick Sonya, consultant with the Liberian Finance Ministry, who was in Nigeria on official assignment, died having been inflicted with the deadly Ebola virus that has claimed over 600 lives in some African countries. The development appeared to have created fears among Nigerians. Against this backdrop, medical practitioners who are Dr. David Iyamu, a family health physician, Dr. Samuel Osagede, consultant gynecologist, and an occupational therapist, Victoria Amu, said Ebola virus is a deadly disease that has no cure for now across the globe. They said investigation showed that the virus was discovered in monkeys and bats, and cautioned residents to be mindful of the two animals.
It's not exactly the same group like HIV, but they are the same group family. Because the HIV is also a virus. But the bad thing about this virus is that the cure has not been found.
It's a virus infection, just like HIV, no treatment. So when a patient comes with Ebola, what they treat is symptomatic management. If you have cough, you treat cough. If you have catarrh, you treat catarrh. You give antibiotics and all that. You give infusions.
Those of our people that are in the villages who eat bats, eat animals, I think they should be more cautious of what they eat. So a lot of us who eat in bukas, all of us should be very cautious of the cutleries and the silverwares we use.
The medical practitioners identified symptoms of the virus, which are severe fever, headache, diarrhea, nausea, and pains all over the body. Other symptoms are vomiting and stooling. They called on residents to immediately contact medical practitioners should they come across any patient suspected to have such symptoms. They pointed out that the virus has no cure and is contagious.
When they see any patient with these symptoms, they should make sure they wear their face masks, gloves, and anything they can do to protect them from inhaling or having access to fluids for these patients, blood for these patients. Many people who survive Ebola can sexually transmit Ebola for the first 2 months of survival, if they survive it.
What this virus does is that it makes the body ability to make the blood clot. It affects that, and so everybody bleeds. And something can affect you from eating, as you can die from inability to eat. So that's how it does, knocking down every part of you.
When you perceive that something is not right, you should run to the doctor. You should be able to make the doctor look at it with all the urgency that it requires.
The foreign national who died of Ebola virus in Nigeria was cremated, while the hospital where he was treated before he died has been closed down to enable experts to fumigate the hospital. Wellington Akodeja reporting.